Hi, Dr. Michael, Doctor. Welcome to our Big Unlock podcast. We are really happy to have you as a guest on our show. It's on our sixth season now, and it's really we're looking forward to this conversation. I'm sure we'll have a very engaging and interesting conversation about dog health, about healthcare in general, and the new trends about AI and all the buzzwords that people want to hear. So welcome to our show, and we like to start with introductions. So happy to, have you give your introduction. Thank you.
Great. Yeah, thank you so much for having me. I'm Michael Docktor, co-founder, CEO of Doc Health. I'm a gastroenterologist by trade. I'm now on this healthcare venture outside of Boston Children's Hospital, where I started my GI career. I was a busy clinician working in both the clinical side as well as innovation and informatics, and found that we had wonderful tools in the world outside of healthcare, and struggled with my own sort of challenges around managing all the tasks that are part of patient care, and found that I was using task management and project management tools that were not built for healthcare, and scratched my head and wondered, why don't we have these things for healthcare? And so that was a journey we started, just over 5 years ago. Spun out Doc Health from Boston Children's, and we've been on a very exciting journey in the world outside of the academic walls, since then. So it's been fun. Excited to talk to you more about what we're doing.
Great. That's a great introduction. Thank you for letting our listeners know. And we usually like to start with, how you came into healthcare, because everyone usually has a really interesting story about, what inspired them, how you wanted to become a physician. And, for you, it's particularly interesting because you've created this interface between, design, technology, and healthcare. And you've gone beyond like just visualizing what you would like to do, or why doesn't somebody fix it, to actually like building it yourself. So would love to hear a little more about that and how you came into medicine and then came into, technology.
Gosh, well, keep me honest here, because I could probably spend the entire podcast on just this question alone. But, obviously my last name is Doctor, so there was some, some obviously planting that was occurring there, and probably led to some.
Yeah.
I'm sorry. Say that again. Sorry.
Manifestation.
Yes, exactly. So there is something to be said for that. Having said that, one of my earliest memories was, wanting to grow up to be a doctor. My younger sister actually had some GI issues when we were young, and I became very close with her gastroenterologist, and followed her on her journey, and unbeknownst to me, ended up really following one of my mentors, and really was inspired to do the work for other children the way my sister was cared for. And so that was sort of the initial inspiration. But you mentioned the word design. It is sort of interesting because my mother is an interior designer. My father is a dentist who specialized in aesthetics. And so design and how things look and feel and work has been just part of my DNA. And it was, it's just an amazing journey, frankly. To sort of see where, I really was a traditional doctor, practicing medicine and pediatric gastroenterology, and never thought about the interface of design and user experience and user interface. And then the iPhone came out, and then the iPad, and that really started me on my journey of exploring app development and software, and wondering why we didn't use these wonderful devices in our pockets the way we ought to. And so that journey started, 10 plus years ago, but really has led me to this perfect intersection now of healthcare and design and informatics, and creating better experiences for patients and providers. So lots to unpack there, but people ask me if I would do it any differently if I did it all over, and absolutely not. I'm doing exactly what I want to be doing right now.
Thank you for sharing that. That gives us so much perspective into, how you came into this field, and the influence of your parents, and, how everybody around you inspired you to do this. So that's actually really interesting. So that leads us into the, how you built Doc Health, and tell us some examples of, how you saw that this could actually be transformational in terms of like actual implementations with clients, or like when you built the tool, did you, visualize that this is exactly what it would do? Did it go beyond what you thought it would do in a healthcare setting? How did that happen? We would love to hear more about that.
We're far beyond where I ever thought we'd be when we first started this journey. I think that's the exciting part. So, fundamentally, we have such an administrative and operational challenge in healthcare, and I think I saw it, at the rock face as a busy clinician that was really struggling to manage all the sort of clinically adjacent work that had to be done for my patients. I have a patient with Crohn's disease; they need to go to an infusion center. There are
Yeah.
all these downstream tasks and administrative and operational things that need to be done by a team of people, and we didn't have the systems to do that. The electronic health record was not built for that.
Uh-huh.
And a quarter of the $1 trillion that is spent, sorry, a quarter of the 5 trillion that's spent in healthcare is spent on the administrative and operational challenges of healthcare. And there really are no tools built for that. We use paper checklists and email and faxes and spreadsheets to manage all that work that happens outside the electronic health record. And, for me, it was the realization that, wow, I'm using these wonderful tools like project management and task management tools that was using to manage software in my other roles as, someone in innovation informatics. And was just, amazed that didn't exist in a healthcare context, where patients in many ways are projects. And there are tasks that are sort of the essence of care that need to be tackled and managed and collaborated on, and provide visibility and accountability to teams that really didn't exist. So what we are now doing is really serving as that productivity platform for healthcare that really didn't exist, that sits alongside in synergy with the electronic health record, that helps manage all the administrative and operational tasks of patient care in a way that the electronic health record was not built for. And some examples of that would be managing patient intake, for example, and all the sort of processes associated with that, referrals, inbound and outbound, all the sort of paperwork and eligibility checking and faxes. It's amazing. Referrals is a great example. 80% of referrals that come into the major academic medical centers, as an example, are still coming in by fax, despite the fact that they're using Epic, which is a wonderful electronic health record. These things are still incredibly manually laborious, and therefore take too long, are incredibly inefficient. Patient care suffers along the way. And there's just a gigantic bottleneck, all around the administrative and operational stuff that, brings patients in, gets people moving where they need to be, takes them on their patient journeys. And that's sort of what we're focused on fixing.
Yeah. So this is what we hear from a lot of our clients and, the other CIOs and C-suite leaders who come to our podcast, that this is one major problem with healthcare, that it's so siloed and the processes are like, really stuck in the dark ages. We were talking to somebody from Athena and they said they had like 800 people, offshore center in India, just for people to screen these faxes. Like when a fax came in, one person looked at it, is this a pizza order or is this like a referral? Which sounds like unbelievable in this day and age, but they said that's how it works. So I'm amazed to hear this from you as well, that so much of the
It's remarkable. Yeah, in fact, Athena is a partner of ours, and we're working on just this sort of referral management, and as an example of an incredibly antiquated process that everyone loses visibility. The amount of manual labor that is required to process these things is just, it's silly in this day and age when all of these things can be done through process automation, through AI and agents.
Exactly. We're talking about agentic, we're talking about voice agents, and then we're still having to deal with faxes. Wow, that's really interesting to know. So
there is reason to be hopeful, but it is healthcare is always many, many decades behind. But the adoption of AI is progressing more rapid than I've seen any technology being adopted in healthcare. So there's reason for hope.
Yeah. So that actually leads into my next question. But before we get there, I just wanted to ask you. So you mentioned that Doc Health is a productivity platform, and that's what it really does for doctors and clinicians and patients and everybody. But in terms of like when we talk to our doctors and our clients and our healthcare systems, the one word that always comes up is complexity, because they're dealing with so many different systems and having to learn a different system each time. So how do you feel about that? Like, where does Doc Health fit in? And is it like another thing that they have to learn and, manage and deal with, or does it like help reduce that burden?
Yeah, it's all about reducing the burden and improving the user experience. So that's been sort of fundamental to our belief system from the very founding of the company. First and foremost, we are trying to become the productivity platform and the hub that is handling the administrative and operational things. And so
Mhm.
instead of it being another thing, I'd
Yeah,
argue that it's
exactly.
the thing. And so we are often replacing again, spreadsheets, paper checklists, email, faxes as the way that we communicate in the, frankly, 50% or more of administrative and operational things that are required for patient care. So, EHR is great for clinical work, for billing, prescribing, scheduling, et cetera.
Mhm.
There's so much that happens downstream that we don't have systems for. And so I'd argue that we are really creating the hub for that. So it's just like the electronic health record is the clinical hub or the operational hub. Together, there's real sort of 1 + 1 = 3. Um, and fundamentally, we are trying to be much more consumer-like in our sort of approach, where our tool is, we can onboard a customer in 30 minutes. We have a free, a free trial that folks can do, and for small organizations that just want to get up and running, they're free to
Mhm.
go use our product, just like downloading an app on an app store or anything in the consumer world. So it's meant to be super lightweight, very end user configurable, et cetera. Again, using that sort of design mantra, like,
Keep it simple.
it's just important for us to have a great user experience. And I think for us, the real challenge is that clinicians don't want another thing. They're busy. They need
That's
to be in the
exactly what
EHR.
I was saying.
Our
Yeah.
our core users, our sort of super users, and the folks that are really leveraging our tool day in and day out are the front office, back office, the operational leaders, the administrative and operational users. The
Okay.
important piece, though, is that we are, often connected to the electronic health record. We are um, we provide visibility for the clinicians so that if they're interested, they can see where our process is at, where a patient is in their journey, but they don't have to be in our system all day, every day, checking tasks and sort of learning another process. So the intent is to provide that hub for
That view. Yeah.
for the administrative and operational people that are essential and part of the care team, broadly speaking. And the clinicians continue to do their work in the EHR, and they're often driving work into our system through their orders or intents that are happening in the EHR.
Okay, great. So is integration with the EHRs like native, like with Epic and Cerner and the big ones, or do you have?
Yeah, yeah, and we're on like with Marketplace and Dr. Chrono, Relation, a number of the top EHRs, including Epic and Cerner. We're working with Mayo Clinic and their Mayo Clinic platform and their Deploy um, platform. The other thing I would mention is, fundamentally, we have many organizations that use our tool that aren't integrated with the electronic health record, and that is simply because, they're a small mental health practice or a small concierge practice or primary care that just needs a hub to do all that administrative and operational work and work
Mhm.
together as a team. And, we spend a lot of time helping organizations define their processes, and their processes then can live in Doc and can be collaborated on, so that they create their sort of operational best practices. So much of that doesn't happen in traditional healthcare organizations. And so our tool is super valuable even when disconnected from the EHR, but obviously the real value comes when we integrate with systems from EHR to CRM to patient engagement tool. And we're
Mhm.
serving again as that hub
Mhm.
and automating as many of those tasks as possible. Then the flywheel gets set up and you start seeing the benefits of automation and work reduction that ultimately, it moves the needle for organizations and they can feel it.
Yeah. So you're saying if there's an integration with the EHR, then it's end to end and people can see like a complete view of what's happening. But even without the EHR, because it helps with the workflow management, it's valuable for
Yeah,
practice.
it's just like, every other industry has, Asana, Jira, Trello, all these
Mhm.
tools. Like that's where a lot of the work actually gets done. That provides
Yes.
value in and of itself to just have, a view
Complete.
into where the patient is in their journey and what is the process that they're following. Obviously, when we integrate with an EHR or other systems, we can automate those workflows, right? We can launch, when a fax comes in, we can launch a workflow for a new patient referral. When a lab order is placed, we can launch a workflow for lab follow-up, or when a patient has a procedure, we can launch a process for, what is the downstream follow-up for that patient, et cetera.
Okay, great. So yeah, so then that leads us into the next question, which is your learning journey with AI. And, what advice do you have for our listeners in terms of how you think, where AI is going to lead us? And especially like you talked a lot about workflows and, automating. So now with voice agents coming in and agentic being the new buzzword, where do you think Doc Health is headed? And are you also looking to implement voice agents? What are your thoughts about that? And would love to hear more about
Yeah, all all of that.
it.
AI is incredibly exciting, and I'd put out there that we're an AI first company. We've been thinking about this for a while. We've already got what we call Doc Intelligence out in the wild in production for our customers, and we started with really just the basics. With some of these foundational models and generative ability to process just large troves of data, and so we can now summarize all the work being done for a patient and create a snapshot for an end user to see, well, what are all the tasks and the workflows and the sort of patient context and even clinical context if we have access to that, so that I can just get a snapshot of what's up with this patient. I could, edit that snapshot if appropriate. I can generate a note that write it back to the EHR so that we're keeping all that operational stuff in sync with the clinical record. And so that's sort of like the first step in the direction of AI and where we're going actively and are already working with a number of organizations around really orchestrating processes. So if you think of our story arc super quickly, we first created the task in healthcare. That's still a sort of novel concept, but that was where we started. We then realized that tasks bundled together create workflows, and those workflows are again administrative and operationally focused. We then can integrate with systems, and those workflows can then be automated largely. And now what we're seeing is that if we have knowledge of what needs to be done, we can now start farming out those tasks to agents and AI. And so using a voice agent as an example to follow up with a patient to see if they had
Exactly.
referral or did they get their, reviewing their lab results. That's all work that we're actively pursuing. We're leveraging AI to extract data from these faxes to automate an inbound referral process, as an example. So I think AI is in the sort of big unlock to use that term here, and we're going headlong into it. And I think we foresee in the very near term, if we zoom out like 5 years from now, the bulk of administrative and operational tasks are going to be done by automation, AI, agents orchestrating, with each other. And we're excited about being a big part of that story. I think that they're ultimately, we need to know what are the tasks that need to be done for a patient. These agents need rails to run on. They need a little bit of structure, and the end user needs to be involved so that they're in the loop, so to speak, that's another buzzword. But clinicians and healthcare providers are in the loop so that they can see where the patient is in their journey and support the tasks where appropriate. But again, the lion's share of those tasks are going to be done by agents, and we're actively building that feature right now.
So are you aligning specifically with any particular, LLM or provider, or are you going to be completely agnostic?
I'd like to think we're going to be agnostic. Certainly, we're doing plenty of building on some of the foundational models ourselves. We're partnering where we can with wonderful tools. Some of these voice agents as examples. We're not building necessarily voice agents. There are some great tools out there, but what we're doing is sort of building our own homegrown AI agents that can manage the processes. Can facilitate some of the handoff from task to task. And so we've always sort of taken the approach that there's a wonderful ecosystem out there. We want to be the hub and connect to the right systems that are best of breed. So whether that's Epic as an EHR, or that's Salesforce as a CRM, and that's other tools that we can leverage to sort of create that healthy ecosystem. That's what we're going after.
Yeah. So I wanted to ask a question about that, because with the LLMs, one of the main problems is, the hallucinations or the repeatability or the, trust factor there. So I
Yep.
saw that Doc is high trust certified. So I just wanted to ask, what are your views on that? Because in terms of using generative AI, when we talk to our clients for implementations on LLMs, or they're more comfortable certainly with the administrative tasks, but even with the administrative tasks, there's always that question, like, how do you, what are the guardrails you put around that? And how do you make sure that the results that you're seeing or you're displaying on Doc Health, stay within those bounds of accuracy?
Yeah.
So what are your thoughts around that?
Yeah, I think first and foremost, AI is incredibly exciting. It's moving at the speed of light, and everyone wants, to benefit from it. I do think the administrative and operational pieces of healthcare are lower hanging fruit, are less
Exactly.
risky, and I think we're still not in a place where we can reliably use it for absolute clinical decision support and autonomy. I think we'll be there for sure in the not too distant future, but I think for now, the administrative and operational stuff that's currently incredibly clunky and manual is just ripe for opportunity with AI. And I think it's important, as you rightly stated, we have to be very mindful of the potential for hallucinations. In our hands, we haven't seen it yet, and I think that goes to our thinking about what are the guardrails that we set, and how do we, of course, keep a human in the loop at this stage to ensure that that output is appropriate, relevant, give the user the ability to edit it, so that we're not purely just spitting out, in the case of like AI summarization of our tasks and workflows, we generate a summary. The end user has the ability to number one, give us feedback. Was this right or not? We haven't gotten any negative feedback yet, but importantly, we give the end user the ability to edit it, so that before that potentially goes out in the form of an email to a colleague or gets written back as a clinical note to the HR, that can be edited and reviewed by an end user. So I think it's, essential to, show your work where, if we're pulling data from various sources, what are those sources?
Yeah.
Yeah, so show your work, give the end user, keeping them in the loop and ensuring that they have the ability to review it and edit it, and certainly tight feedback loops with the end users to ensure that we're getting feedback. And if there is something that is off, we should, make sure that we're monitoring that and modify it where appropriate. But I have to say even the foundational LLMs are getting pretty good at this, and the hallucination factor, again, in our hands in relatively narrow use cases right now is quite impressive. I think it gets harder as we get into high risk clinical decision support, but invariably we're going to get there very quickly.
Yeah. So it's interesting you mentioned, humans in the loop, and the fact that people can review or edit whatever they're putting out there. But now with agents, what we're seeing is that, one of the key defining characteristics of agents is that they're autonomous, and they can, do API calls, or, push these emails on their own, or even like browse the web, find things and do things on their own. So would love to hear your thoughts about how that's like another level of control that we are seeding.
Yeah.
Like
Yeah.
so
Yeah, I think it is that balance, right? Because you obviously feel the value with task automation and workflow automation. And for us, I think part of our strength is having a user interface where the end user can actually see where a process is in its journey. We're working on things like showing the confidence level or confidence of a particular, here's a confidence interval, say, on how much the data that we extracted from from a fax. And so how do we, number one, show our work, talk about the sources, and using our interface, which again, just breaks up workflows into the tasks, we can show exactly where that process is at. And if we feel that a human needs to be involved in that process, then they're assigned to a task and called upon to sort of review or whatever. So even in the agentic future, which we are, again, it's upon us.
Yeah.
I mean, it's actively being built and tested. I think having still there are ways to keep humans in the loop, and I think um, operating in a vacuum is challenging. And I think
Yes.
part of my sort of mantra, just having been a clinician, and part of the reason I'm here is because I lacked the visibility and accountability in the work that was being done on behalf of my patient, in this sort of black hole of faxes and emails. I think it's important for us to sort of show where the patient is in their journey, where process is at, whether agents are doing it, or simple automation of moving data from one system to the next, giving folks visibility into the process, and going, being able to drill down if necessary, I think is important.
So that's an interesting, viewpoint that you brought up, because you earlier mentioned the front and back office and the clinicians, but I didn't realize that patients also have a view into the system. The patients also can see where they are.
So, that's certainly the vision for the future. At the moment, our solution is really all about, creating the care team and giving them visibility and accountability to where a patient is in their journey,
Oh,
relative to a process, an outbound referral as an example.
right, right.
Ultimately, the patient is part of the care team, and we would love a future where the patient was assigned tasks and the care team had visibility into
Exactly.
them.
They
I
actually
think
participate on their own.
that too is an inevitability. We're still focused on giving the care team, in the traditional sense, that the clinical and administrative and operational people what they need, their tools. And my hope is over time we can bring the patient and their own sort of care team at home into the fold.
Okay, great. So I think we're almost at the end of the podcast. So, we would like to conclude by asking you what you think, maybe give a horizon of like a year and then maybe a 5-year horizon. What do you think the top 5 trends or the top 3 trends are going to be in AI? And particularly for you at Doc Health, what are the 3 things that you are really keeping close tabs on and you feel that it's going to really impact your product and, be very transformational?
Yeah, it's tough to predict because AI is moving so fast, and
Yeah,
the sort of
light
Moore's
speed.
law is out the door, and the doubling is happening like every 3 months now,
Mhm.
which is just phenomenal to watch. So I think everything is AI right now, and AI is agentic is the sort of word of the day, and I
Mhm.
even heard the word sort of ambient agents, which I think we think about this as, again, the workflows that we are helping to orchestrate. Agents are going to be doing the bulk of those in the near term. I think, I've had imagine when we first started Doc Health, one day when Doc is smart, we're going to be able to do all these things. And AI has accelerated our roadmap by,
Mhm.
5 to 10 years. And
Yeah,
that continues to sort of shrink.
shrink.
And so I truly believe, like, in the next 5 years, when healthcare spend is something like $2.2 trillion just on the administrative and operational side, it's going to be a $10 trillion US sort of healthcare spend. The administrative and operational things, that cost may actually shrink over time when we can be more operationally efficient. And I think that AI is the key to unlock that.
Mhm.
And again, I think that you know, we want to provide the care team superpowers. We want to give the administrative and operational people better tools to do their good work, so that, I went to med school not to, do, you know, documentation and billing and
Absolutely.
tracking down tasks for patients. And like, maybe, healthcare, because we've got, ambient scribes that now can listen to our conversations and deal with the documentation. I believe the same is going to be true of the administrative and operational nonsense that we all have to do in healthcare. And so, yeah, and it's going to happen faster than we even imagine. But I think 3 to 5 years from now, the bulk of that work is going to be uh, automated, hopefully with a human in the loop to a certain degree, but hopefully not to a certain degree.
Yeah.
And
It'll
it's
be in the
just going to happen
background. It'll
magically.
just happen magically. Yeah.
Yeah, it's going to feel like magic. I mean, if we zoom out 5 years from now, it's going to look like magic, but it's
Yeah.
going to be super obvious by then.
Yeah.
But I'm excited for that future, because at the end of the day,
Mhm.
patients need, our economy, our world needs more efficient care. The fact that we're wasting $1 trillion a year on administrative and operational nonsense is shameful. Um,
Yes.
and you know, we put so much work and effort on the patient to remind us to, and by us, I mean the physicians and the care teams, you know, call me if you don't get your referral in a couple of days, or, you know, I was on the phone with my mom last night and she had to go track down a lab result and all that. I mean, these things happen because we're human, and because you know, we don't scale very well, but we now have these incredible powers at our fingertips. And so I'm really excited about the coming few years. It's really the most exciting time in healthcare that I've ever experienced, and I'm sure the world has ever experienced. And I think healthcare is super primed for, you know, opportunity
Complete
with AI.
transformation.
Yeah.
Yeah, great. So thank you for being with us on our podcast, and it was a wonderful conversation. And we look forward to, you know, putting this out there and showing your vision for the future with our listeners. Thank you so
Thank
much.
you so much.
Thank
Yeah.
you. Take care. Bye-bye.
You too. Thanks so much.